Hello everyone. I am Dr. Srinivas Vinayaka Shenoy, Associate Professor in the Department of Nephrology at Kasturba Hospital Manipal. Today I am here to discuss about a very important topic with all of you, which is diabetic kidney disease. It is very important to know about diabetic kidney disease because, as you can see maybe in your family or elsewhere, the incidence of diabetes is continuously increasing. So within your own family, there may be many people who may be affected by diabetes. In fact, India is said to be the diabetic capital of the world. So there are more and more people with diabetes who are developing this diabetic kidney disease, which is a form of chronic kidney disease. So how does one develop diabetic kidney disease? As we would recall from our school days, each person has two kidneys with a number of functioning units called nephrons. So these nephrons are basically the functional unit of the kidneys, which do the work of the filtering, maintaining the acid-base balance, electrolyte balance, as well as the water balance in the body. So in a diabetic patient, when the sugar levels go very high, so these nephrons are affected because of the high sugar, because of different metabolic alterations which occur within the kidney. So because of the deposition of certain products within the nephron, so they start dysfunctioning, that is, it causes kidney failure, as well as phenomenon called leaking of protein in the urine, what we medically call as albuminuria. Usually there are two types of diabetic patients, type 1 and type 2. Type 1 diabetes is mainly which starts in early childhood, whereas type 2 diabetes, which is the more common form of diabetes, it occurs usually in adulthood. So patients with type 1 diabetes, generally they develop diabetic kidney disease after 5 to 10 years of the disease, whereas patients with type 2 diabetes may also have diabetic kidney disease at the time of detection, because many of these patients are unaware of their diabetic status. What are the signs or symptoms that one must understand to see if he has diabetic kidney disease? As I mentioned, in the early stages of this kidney disease, most of the patients do not have any symptoms or signs per se. But there are few symptoms or signs which, if a patient is able to identify, may help him seek medical intervention early and diagnose this disease. So one of the symptoms that patients early on in this disease develop is frothing in the urine. So what I mean by that is, whenever somebody passes urine in the bathroom, you would notice that there is some froth. But in patients with diabetic kidney disease, there will be lot of frothing which is abnormally more. So this could indicate that there is some albumin leak or protein leak in the urine. Second point is, patients normally, whenever they travel for long distances or they are sitting for a long time in their office, many of them develop leg swelling. So leg swelling is due to increased water content in the body, which can again be a sign of kidney disease. So anybody having this symptom who is a long-standing diabetic also needs to seek medical help to diagnose whether the patient has kidney disease or not. And other point which I would like to mention is, most of the patients with diabetes, whenever they go for their regular health checkups, if they develop hypertension, because high blood pressure and diabetic kidney disease go hand in hand. Majority of the patients who develop diabetic kidney disease also have hypertension. So any patient who develops hypertension or has high BP recordings during their healthcare visits, it is better that they once get evaluated for presence of any underlying kidney disease. So now, after having known what are the different signs and symptoms that a patient needs to know about diabetic kidney disease, let us now proceed to what are the different tests which can be done. A number of tests can be done to detect the presence of a diabetic kidney disease. First and foremost, probably one of the easiest tests is a urine analysis. As I mentioned earlier, one of the hallmark or one of the characteristic feature of diabetic kidney disease is having protein leak in the urine. So there are tests called as urine for microalbumin or urine for albumin as a dipstick, which can detect the leakage of these proteins in the urine. It's a simple test and just needs a urine sample. Apart from that, there are tests which assess the kidney function. So the tests are like urea, creatinine, sodium, potassium. So these tests basically assess how the kidneys are functioning. If the nephron or the functional unit of the kidney is damaged, the creatinine will be high. In normal individuals, we see creatinine to be around 1 to 1.1, but whenever there is kidney damage due to diabetes, the creatinine would go up. Say it would go up to 1.5, 2, or even higher. So that is again test which can identify if your kidneys are damaged or not. Then apart from these tests, all the patients with diabetes need to undergo regular for their diabetes control, be it fasting sugar, postprandial sugar, glyco-HP, because that will give an idea as to how the disease is under control. So now coming to what are the treatment options for diabetic kidney disease. The disease control or treatment can be divided into two parts. One part is you are going to look at the risk factors for the diabetic kidney disease, and second part of the treatment is going to look into the disease per se. So risk factor, as I mentioned, for diabetic kidney disease is uncontrolled diabetes. So anybody who has been having diabetes for a long time and which is uncontrolled, so these are the patients who are more prone for developing diabetic kidney disease. So it is important to have a regular follow-up with your physician or with your endocrinologist to keep your diabetes under control. So it could be either with insulin or medications. So you will be guided by your doctors regarding how your sugar can be kept under control. The same goes with control of your blood pressure, because as I said, many of the patients with diabetic kidney disease also have hypertension or high BP. So it is also important to control your blood pressure. Then there are certain medications which are available. For example, AC inhibitors or angiotensin receptor blockers, SGLT2 inhibitors, mineralocorticoid receptor antagonists, which are newer class of drugs which can work in trying to reduce the progression of your kidney disease. But all these medications need to be taken under medical supervision, and it is better that you are in a regular follow-up with your nephrologist, who will then guide you regarding how these medications are to be taken. Now coming to the last aspect, which is the prevention of developing diabetic kidney disease. So many of the diseases can be prevented if they are detected early. So early detection is one of the most important ways how this diabetic kidney disease can be prevented. So most patients who are diagnosed with diabetes, especially type 2 diabetes, they need to check for presence of protein or albumin in the urine, and as well as check for their serum creatinine at the time of diagnosis. Suppose any patient does not have kidney disease at the time of diagnosis, it is advisable that every year the patient undergoes testing to look for presence of any albumin in the urine, or look if the serum creatinine is high. So that way we will be able to detect the presence of kidney disease in the early stage, and then we can refer the patient to the specialist doctors, and then the treatment can be initiated so that the patient does not develop further worsening of his kidney disease. So my concluding advice to all the patients who have diabetic kidney disease is that there is nothing to worry. You need to control your diabetes, you need to have a healthy lifestyle, and you need to be regular with your medications and be regular with the follow-up with your doctors. There is a solution for most of the problems. So I am sure your doctors and will help you in bringing your disease under control. Thank you.